A very good evening and welcome to the India Development Debate. I'm Tamanna Inamdar and it's been an exciting news day today. You're going to see a lot of that, the top stories that need more analysis on the show this evening. So quickly, let's run you through the menu. The world's first vaccine may be out there. It's a claim that Russia has made. They're calling it the Sputnik 5 and say that they will start inoculating Russians as early as the next few months. The question is it safe? Can we take this claim at face value, especially a vaccine that has come into being so quickly? That's the first big story we're discussing on the show. We're also going to tell you how the rest of the world has been responding to the Russian claim. The other very important development today has come in from the Supreme Court that has ruled the 2005 amendment to the Hindu Succession Act will be implemented retrospectively. This is a very crucial decision which could possibly open a floodgate of fresh succession battles, because it says, like in 2005, that daughters have equal rights to ancestral property, but the timeline of 2005 has now been removed. That means older cases can also come to the fore. We will have top lawyers to explain the implications of this. And on the India Revival Mission Special this evening, you will hear from Maruti top boss R.C. Bhargav. But let's get on to our first and big story, where we are talking about Russia's claim. Now, Vladimir Putin has come out and said that there is a vaccine. They have got the vaccine in place and large-scale production of it will start as early as September. Mass vaccinations may begin as early as October. They say they already have 20 countries around the world lined up to buy, and these are vaccines for which trials have begun only in June. Now, why is the world concerned about this? The world is concerned about this because phase 3 vaccines and mass production and mass testing is going to happen at the same time. So they have decided to give a final stamp of approval before the phase 3 stage of vaccines. This is very important. Now, why is this crucial? Should there be skepticism about Russia's claims, or should we now be overjoyed that the first vaccine has finally hit? I've got Dr. Sanjay Badhwar with me to break down all of this. Dr. Badhwar, very good evening. Great to have you on the show. What do you make of Russia's claim?
Good evening. These are exciting times in the world of science. At the outset, I would like to say I have the greatest respect for my colleagues in Russia because I've interacted with several doctors as part of our cochlear implant program. But I would say early days yet, because if you look at the timeline, the fastest vaccine to have been developed was the mumps vaccine, and it took 4 years. HIV has been around for 4 decades, and we still don't have a vaccine for it. And the number of vaccines which make the cut are very, very low. Now, the vaccine production, yes, has been put on fast track the world over, but there are no shortcuts. When you develop a vaccine, you have a pre-exploratory stage, you have animal trials, you have phase 1 trials, where a selected focus group of individuals, basically you test the dose of the vaccine and some safety aspects. Once phase 1 is over, you move to the next phase, where you deal with hundreds of patients and you look at the dosage and the safety aspects. And then you move to phase 3, which may be hundreds to thousands, where you would again look at safety, efficacy, and rare side effects. So that begs the question, have we done all that? No. We've had a rush phase 1. We had a phase 2 with 76 patients only. Granted, early results may show that the vaccine is efficacious, but any such product has to be validated by the world's experts. And with due respects, the lab which is producing the vaccine has not shared its data. So none of us know what is actually true, what has been claimed, and none of the world's experts can opine on this. So I would say early days yet.
So the World Health Organization has also said that we will wait and watch to see, what the claims really are. Interestingly, Putin has, to get confidence on his people, said that his own daughter has taken the vaccine, and he clocks her temperature and says it was fine. It was 37 degrees one day, it was 38 degrees one day, and she was fine. I just want to read out a statement to you, Dr. Badhwar, from the Russian news agency TASS. By the Russian health minister's chief non-resident epidemiologist, who says this vaccine wasn't developed from scratch. The Gamaleya Research Center had a serious, significant research base on vaccines. The technology of developing such a vaccine was perfected. So perhaps the process was sped up due to the fact that the vaccine was not created from scratch. Now, the reason I think this is important to highlight is because that's the case with a few other vaccines also, which are up for COVID-19 and are trying to, make it to production. There are others which were being tested for different things before everyone knew about COVID-19. And that same research has carried on. Do you think that that is a valid justification for the shortened timeline?
No, sir. You see, basically, these are viral vector vaccines. In this instance, it's an adenovirus, the common cold virus, which is coupled with the spike protein of the coronavirus to stimulate antibody response. Similar vaccines are developed by the Oxford group and by another group in China, which are undergoing phase 3 trials in hundreds and thousands of people still. So those results have still not been validated. So I don't think that claim is justified.
Okay. Do you think, Dr. Badhwar, that at this time it's all become a lot of chest thumping? Which country does it first? Who wins the race? And Russia basically wants bragging rights that they've made it first. Do you think that's a dangerous trend when it's about the health of billions of people?
You see, Tamanna, right throughout, it's a very unfortunate statement, but the management of this pandemic, I would say, be it in the US, be it in our country, everywhere, there's been a political aspect to this, which should not be so. Science has to be pure, and it has to be left to the doctors. The naming of the vaccine, Sputnik 5, again, begets some questions, because there was a race between the US and the Americans to have the first spacecraft launch. So that begets the question, is it a political statement? And sometimes, particularly in this race, I would like to be the first. I would like to see what happens, see if there are any side effects, and then cautiously take a call.
Yeah. Absolutely. And I'm sure agencies in India will do the same before taking on any claims made by any nation, including Russia. Thank you so much, Dr. Badhwar, for putting that big story into perspective for us this evening.
Good night.